Hello and welcome. I'm Yasmin Ahmed, lecturer at DADABHOY Institute of Higher Education. This presentation is about diseases associated with unsafe drinking water and how to control them. Water sustains every living on this earth and interact with them in a number of ways. Water is used for ingestion, taking shower, washing hands, and so on. The diseases associated with water are also classified based on water usage. Today, we are going to educate you about classification of diseases associated with unsafe water usage. This educational video is being brought to you by the DADABHOY Institute of Higher Education Support Program for the ScienceLiteracy.net initiative. If we classify diseases associated with water usage, then there are four categories, that is water-borne diseases, water-wash diseases, water-based diseases, and finally vector-borne diseases. Now we will discuss each and every one individually and the ways to stay safer from these diseases. We will discuss water-borne diseases first. These are linked with the consumption of water, especially drinking water. It is caused by presence of pathogenic microorganisms in water. Most common diseases caused are bacillary dysentery, cholera, and diarrhea. There are different types of microorganisms, including bacteria, parasitic organisms, and viruses. Here, we will discuss different types of infectious diseases due to presence of infectious organisms in water. Among these bacteria causes infections like cholera, typhoid, and so on. Major bacterial strain causing cholera is by Vibrio cholerae, whereas typhoid is caused by Salmonella typhi. Then comes parasitic organisms like Cryptosporidium and Cyclospora causing cryptosporidosis and cyclosporiasis respectively. In the category of viral diseases linked with ingestion of contaminated water, viral gastroenteritis caused by rotavirus and noroviruses have been threatening public health system of several nations. Importantly, reports about the hepatitis E virus contamination in water causing jaundice also exist. Regarding fungal spores, there are issues, however, never got significant attention. Regarding waterborne diseases due to chemical contamination, we will discuss separately in another video about these diseases. For controlling waterborne diseases, we recommend a few suggestions here. However, these should be mandatory precautions for people living in poor sanitation area. Using boiled water is the best way to save yourself from waterborne diseases. Be careful in consuming salads, fruits, raw vegetables washed with water from the poor sanitation areas. Use pasteurized milk or heat it at home. Avoid using ice cubes. See doctor advice in case you suffer with diarrheal disorders of enteric intestinal ailments problems. The second category of diseases associated with water are linked with personal and community hygienic conditions, including supply of safer water. This category of disease are grouped into water-washed diseases. Water-washed diseases are not related to drinking water, rather usage of water for external body surfaces or contact of water. Inadequate clean water availability, poor sanitation, and inadequate hygiene is involved. There is a broad list of water-washed diseases. However, few worth describing are conjunctivitis, pink eye, viral adenoviruses, several varieties are there, bacterial Staphylococcus aureus, Haemophilus influenza, Streptococcus pneumonia, and Pseudomonas aeruginosa, dysentery, Shigella and Campylobacter, leprosy, Mycobacterium leprae, causing eye secretion, reuse of common water areas, scabies, a parasite Sarcoptes scabi var hominis is involved. Skin infections. There are several skin infections in the list. And trachoma, preventable blindness due to a bacteria, Chlamydia trachomatis. Ulcers. There are several different ways which can be implemented for controlling water wash infections. The most important one is improving hygienic conditions, developing hand washing habits with appropriate antimicrobial hand wash, proper cleaning of cooking and eating utensils with hot water. Hand washing after using the bathrooms and so on is a very important habit. Water wash diseases control is through collaborative efforts of the government and communities, and it involves with the good hygiene practices by the community and the government control over water supplies. Provision of properly treated water included continued monitoring. Now we are going to discuss water-based diseases. These are the diseases in which humans come in touch with water contaminated with certain microorganisms accidentally. Glaring examples are schistosomiasis. Aquatic snails carries the free-living larva for disease-causing organisms. Guinea worm. Cyclops, residing in water, carries this worm. Now, the very important question which arises here is how to save ourselves from water-based diseases. Avoid getting in touch with contaminated water. Both schistosomiasis and guinea worm diseases have significant public health burden. Expert physician help is needed in case you come across with these infections. Now we are going to discuss the fourth type of diseases, which is vector-borne diseases. These are the diseases which are mainly caused by insects. These insects mainly live in water reservoirs. There are mainly two types of diseases which are caused by these vectors or insects. Mostly they are caused by mosquitoes and flies. Mosquitoes are the reasons for malaria or dengue fever. Malaria is caused by female Anopheles mosquito which transmit malarial parasite the Plasmodium. Dengue fever is caused by Aedes mosquito infected with dengue virus and thus they transmit the disease. Secondly, flies. Flies causing sleeping sickness or river blindness. Sleeping sickness is caused by tsetse flies which carry the parasite for this disease, whereas river blindness is caused by black fly. Now I will like to discuss with you that how can you control vector-borne diseases or keep yourself safe from them. Some of the strategies which you can apply are to eliminate breeding sites of vector. Eliminating vector population through regular spray is a very important step to be taken in collaboration through government and private sectors as well. You should be able to keep your body part covers most of the time so that vectors do not have access to bite you. And most importantly, seek medical assistance if you become sick with these diseases. DADABHOY Foundation supports several initiatives benefiting humanity. Among these, the most important ones are CPSD, ScienceLiteracy.net, and DADABHOY Institute of Higher Education.